Good morning, everybody. How is everyone this morning? All right, welcome to the White Coat Ceremony of 2022. This is the graduating class of 2023 that we're here celebrating today. We thank you guys for all coming in and attending, celebrating your family, celebrating your children, your grandchildren, whatever it might be, whatever relations, friends, family. We thank you all for coming in today. Before we start, we have a message from our program director, Dr. Carrie Gilbert, who's not here today, but we're going to turn it over to him.
Today, but I serve as the program director for the Doctor of Physical Therapy. Hey gang, welcome to the White Coat Ceremony. My name is Dr. Carrie Gilbert. I'm really sorry I can't be there with you today, but I serve as the program director for the Doctor of Physical Therapy program. And the students that you've come to celebrate today have made a tremendous accomplishment in their life. They're about to launch into their next phase of clinical training into clinical affiliations or clinical internships. And we're excited about that. This White Coat Ceremony represents the transition from didactic to clinical learning. And so we're glad that you joined us to celebrate today. I just wanted to take a moment to tell you thank you for coming. I'm sorry I can't be there, and help you to recognize the people that put this together. The student leadership team, the faculty and staff have all done a great job to put this event on, and so we're very thankful. The students that we're celebrating are among the top of the top. We have 750 applications each year or more, and so really it's about 1 in 10 that actually make it into our program. And so what we're celebrating today is their accomplishments and their transition into clinical practice. So parents, family, friends, thank you for being here. Faculty, thank you for your investment in our students' lives and their education. And students, thanks for giving of yourselves to become the best clinician that you can be. I want to leave you with a couple of things though. First, I want you to learn always. I want you to be excellent and do something. So learn always, be excellent, and do something. Learn always. There's always something that we can learn. Every one of us has the opportunity to keep learning throughout our career, and it's easy to get stagnant, but stay focused and always keep learning. I want you to be excellent. You're the advocate that can most effectively advocate for your patients. Step into that, embrace that challenge, and help them get the care that they need. And then do something. Every one of us has some gift and some opportunity to share with others, and so do something to help make somebody's life better. We're proud of you. We're proud of the accomplishments you've made in our program, but more importantly, we look forward to what you're going to do out in the clinic on your clinical internships and beyond into your career. Go make us proud. We're excited for you. Reckham.
All right, well, that was Dr. Carrie Gilbert, our program director. My name is Nathan Burgess. I am our associate program director, and I'm housed on the Lubbock campus. We've got a great group of students here that are heading out into the clinic. As Dr. Gilbert mentioned, the White Coat Ceremony marks that transition from didactic learning into your clinical experiences. There's different variations on how people do White Coat ceremonies. Some institutions do them just like we are, as that transition from classroom learning to clinical learning. Others do them at the beginning of the professional education, so right when they come into school. Other institutions do them as the graduation ceremony. We actually had that happen last year. We had 2 White Coat ceremonies because the 2020 group couldn't have their White Coat ceremony at the normal time, so we did it as their graduation ceremony. So just one of those things, there's a little bit of variation on how people do the White Coat ceremony. It's a relatively new practice. It's only been around for about 30 years or so. I think the first full ceremony was done in 1993. And of course, it started in schools of medicine, medical schools, but then it was quickly adopted by other health professions. And so you see physical therapy, PA, Sometimes nursing is a little bit different ceremony. You do a pinning ceremony or a hatting ceremony depending on the institution. But there's variations of this theme that go throughout healthcare. And we think back to kind of why white coats. What's special about this? And this goes back to the 1800s when, think about medicine and the state of medicine in the 1800s. Okay? They didn't know a lot at that time. They were still figuring things out. So there was a lot of quackery, honestly. You know, they sell you the bottle of syrup and it's going to cure everything that you can possibly imagine. There was a lot of mysticism that was involved in medicine in that, 19th century medical practice. So as we got into the 20th century and healthcare really became more and more science-based, physicians adopted the white coat because the white coat was a symbol of science. The laboratory scientists wore the white coat in the laboratory as they were conducting their experiments. And so medical professionals began adopting the white coat to symbolize this idea and to make that connection between healthcare and science. Because what we do isn't quackery. What we do is no longer mysticism. There is evidence behind the things that we do as healthcare practitioners. And you guys have spent the last 2 years learning about the science behind what you're about to go out and do in your clinical practice. Okay? So this is why we're here today. You guys are entering the clinical portion of a doctoring profession education. Okay? And what does that mean to be a doctoring profession? We're not doctors. We're not medical doctors. And we don't claim to be medical doctors. Okay? But what we do is we take care of patients who are in a vulnerable situation, okay? Whether it's a broken pinky toe or a person who's had a stroke, that patient is coming to you in need, and they're coming to you to ask for guidance and for assistance in how to get better, to regain function, to reduce pain, whatever it might be, okay? So that is the kind of the ethos behind a doctoring profession. The DPT, the Doctor of Physical Therapy degree, is the universal degree across the United States. Every PT that comes into practice now has to have a Doctor of Physical Therapy degree. One of the things about a doctoring profession is we kind of self-regulate. We're guided by a code of ethics that was created by our profession. And I'm not going to read the code of ethics because you guys don't want to be here for the next 2 hours, okay? But I'm going to just read a few words from our code of ethics, words that have some meaning. Dignity, rights, trustworthy, compassionate, accountability, integrity, lifelong learning, social responsibility. These are words taken directly from your code of ethics, the code of ethics that we practice by and that you will be practicing by in treating your patients, okay? Dr. Panassi spent some time going over the code of ethics and professional responsibility, or I'm remembering the name of the professional development in the first summer of your education, but that was 2 years ago. Go back and review that code of ethics. Remember what you are called to do in this profession. So with that said, we welcome you again to the White Coat Ceremony of 2022, celebrating the class of 2023 as they leave the classroom and head out into basically 2 semesters full of clinical experiences. So we're looking forward to what you guys are doing in the clinic, and we'll continue on with ceremony.
All right. Well, welcome everyone. I want to start off by saying welcome to all the friends and family to this White Coat event. Your support is not only appreciated by the students of your loved one that you're here to support, it's appreciated by the faculty as well. So thank you for your support of the students throughout this time. I also want to welcome all my students. I'm proud of you. Good to see everyone here. So my name is Reed Gehring, and I'm one of the 3 professors teaching from the Amarillo Campus, and I have the privilege of teaching these young, bright students. And I teach them on a number of subjects. My specialty is actually in orthopedic physical therapy. That's what I love. But I just love being able to have interactions with them and all the different subjects that we cover in the curriculum. Like I said, I'm from the Amarillo Campus. And our Amarillo campus is one of 3 campuses that comprise the DPT program here at Tech. And Amarillo, I don't know if you've been there, but Amarillo is a unique place. And we're proud of our little city, its friendly people, its medical community, and its unique weather and landscape. And yes, we actually got some rain last night too. Yeah, so thank you. Our Health Sciences Center is located on the western edge of the city, and there you can witness some of the most gorgeous sunsets in God's creation, and you can also experience some of nature's most forceful winds. There's no trees at that part of the city. But I'm proud of our growing DPT program here at Texas Tech and the students that come here to give it life. It's been such a pleasure to teach this group of students, and especially the 18 on the Amarillo campus whom I've gotten to know the most. They are a hardworking and intelligent group of young men and women, always respectful and kind, dedicated to their studies and to each other and to their future in the profession of physical therapy. The PT students in Amarillo, they're a diverse group. We have many former athletes, such as gymnasts, swimmers, powerlifters, track runners, baseball and softball players, tennis players, and soccer players. And I'm not sure if bass fishing is a sport, but we have one of those too. And we also have students that have roots from many parts of Texas, New Mexico, Virginia, Minnesota, but also from Central Europe and Africa. All of them came here to Amarillo and to Texas Tech to learn the art of physical therapy. But what I want to emphasize the most today for the students from all 3 campuses in our program is just how much of an impact you'll have on your patients in the future. These patients will be in need of your clinical expertise, your wisdom, your compassion, your empathy, and your healing hands. Serve these people with the skill set you've learned while here at Tech, and also build upon it. Use your God-given abilities to mend the broken and uplift the downcast. And lastly, always remember that healing comes not just from your actions, but also your words. Never underestimate the power of your words. I wish all of you the very best of experiences and learning in your upcoming clinical rotations, and know that even though you may be far away from your home campuses, we are still here to support you, encourage you, and cheer you on. Congratulations. Thank you.
All right, Amarillo, are you ready? I'm Misty Miller, and I am one of the other faculty members on the Amarillo campus, and I get the pleasure of starting with our Amarillo group for their white coats. I'm also the director of clinical education, so these guys are mine for the next year while they're out in the clinic. So all of you, I look forward to continuing to work with you while you're out in the clinic. All right, I think they're ready. All right, here we go. We have Oluwatosin Chamikwane. Congratulations. Emily Cottrell. Michelle Iso. Christina Garcia. Nathan Jin. Madison Hester. Bailey Jeffries. Barbara Krijanova. Kyla Mann. Laura McDaniel. Morgan Nix. Colt Oliver. Logan Pierce. Alyssa Reynolds. Jason Verogese. Michelle Veronin Tokoff. Michael Wagaman. Michaela Watley.
Excuse the beard mask for a moment. So good morning, everyone. I'm Gary Kearns, and I'm at the Lubbock campus. And so even though today is definitely a celebration of you guys reaching the finish line of your classroom education, hopefully, right? We also want to celebrate about what's next, right? And so what's next is you guys actually getting into the clinic. And so rather than you hearing stories from us about the clinic, you begin to get some context, right? You begin, come on, guys. You'll get to see the ebb and flow of the clinic from day to day, right? But really, you get to see what your career is going to be about. And this reminds me of a piece of advice my father-in-law gave Lynn and me when we graduated from PT school. And he's a man of few words, and he said, just remember, you have a career, not a job. And that was it, right? So I think what he was trying to say is don't get complacent. When you get complacent with what you do, it turns into a job. I think what he was also alluding to is you guys have a chance to impact your patients on a daily basis. And as proud as the faculty is of the education that we give you guys, nothing is going to really give you that context like your patients will. Your patients are always going to be your best education. And then you'll also get to see why we're so fond of saying it depends. So as you go into the clinic, here's some hopes, prayers, and some last little kernels of wisdom for you guys. Don't take yourselves too seriously. You've got to be able to laugh at yourself. Because if you don't laugh at yourself, somebody else is going to laugh at you, right? You might as well be laughing with them. There's a lot of joy and laughter. I pray that you keep an open mind. You're going to see a lot of different things in the clinic. Different doesn't mean something is right or wrong or bad or good. It's just different. It's what makes our profession so great. I also hope that you question everything. Now, obviously, you want to do that respectfully, but be comfortable questioning anyone and everything, right? I strongly encourage you to ask, why not? Right? Doing so is the only way your practice is going to evolve and that the profession is going to evolve. Get comfortable being uncomfortable, right? You guys are going to have a lot of opportunities on your clinicals. Don't shy away from challenging opportunities. Embrace them. Engage in challenging discussions. Just avoid divisive discussions. Right? But the big thing is going to be focus on your patients. Right? As I said before, they're going to be your best education, but you guys are kind of chomping at the bit to integrate your knowledge and all the skills that you have into the clinic, but don't overlook an opportunity to connect with your patients. Right? You're not treating pain, you're not treating symptoms, you're not treating impairments, you're treating patients. Right? They're unique individuals. Treat them like family. Listen to them. Laugh with them. Cry with them. Pray for them and pray with them. And probably one of the most frustrating things you guys are going to have to acknowledge, and it's still true for us up here today, is you're not always going to have the answer for your patients, right? You have to be okay with that. But even in those situations, if you don't have the answer for them, you can still be present for them. Right? Be there for them, listen for them. And above all, I hope that as you guys go out, you find your passion, that thing that you want to pursue for the rest of your life. Even if it's not musculoskeletal, I'll be okay with that, right? But above all, we pray for continued safety and health as you guys travel across Texas and beyond. Just know that we're very proud of you, your family is very proud of you, and I pray for continued success and growth over the next 8 months. Thank you.
All right, I think we're ready. We'll get to the meat and potatoes here. I had to try and do a Dr. Kearns thing. I don't know. I don't hear him say it ever. My name's Dr. Kate Panassi. I'm here on the Lubbock campus, and I'm going to proudly read the names for our group. So first we have Rachel Allen. Congratulations. Taryn Blackstock. Congratulations. Colby Bullock. Sarah Carter. Abigail Chase. Mallory Clark. Megan Conroy. Jenny Degnan. Callie Duweny. Bailey Jones. Miko Macapagal. Did I get it right? Kimberlyn Manzella. Abigail Mennerly. Alec Munoz. Nicole Ochotnicki. Caitlin Opperman. Sophie Pavlos. Tori Rathman. Robert Reaver. Holly Rhodes. Olivia Robertson. Leah Salazar. Brittany Sanders. Sarah Schindler. Morgan Schwartz. Keegan Shin. Jacob Smith. Peyton Starch. Waiting for the air horn. Lee Sturdivant. Christina Thompson. Kelsey Thompson. Sarah Varghese. Brooke Wurtzberger. Edie White. Michael Willis. Taylor Woods. Julia Wright.
Okay, so here we go. So got a couple things I wanted to start off with. I wanted to start by introducing myself. I'm Josh Timbinsel. I've had the pleasure of having your guys' friends, family, and them as students for the last couple of years, significant others, and what a wonderful group. And so I've had a wonderful learning experience from them, and I hope that they've had a wonderful learning experience from me. So I don't know about that sometimes when they get in the middle of a pathophys test. They're probably not thinking that, but anyway, okay, all right. And then after watching Dr. Gehring's speech, I decided I wanted to add a little something here. I bet you Dr. Kearns can chime in on this, but kind of wonder what a product he uses in his hair, you know? I mean, it's probably like mousse or gel or something like that, or maybe just a combination shampoo. It's like comes in one bottle. I really don't know, but maybe it's something really cool that they didn't even have back when I had hair, with like pomade or something. But anyway, so I figured I have a little hair envy going on there. So, all right, since we're done with that, all right. So, first, you students, were the last 2 years as easy as you thought they were going to be? For a lot of you, it's probably not, okay? And so I'd like you to think back about some of those challenges that you guys faced when you were coming into school. A lot of you were finishing up your undergraduate degree right in the middle of a pandemic, and everything switched to online learning and changing your style of learning, and maybe not your preferred style. And then you came into the graduate program and you got into anatomy, and where you had all the lectures front loaded and then all the labs back loaded, and how hard of work that was for you guys, okay? And I know that that was a great transition a very challenging transition for the anatomy team too, and the professors too, because I also came on board the day before we went to online learning. So it was a very challenging transition for me too, okay, all right? That online portion of it was very different from what I was used to, okay? And then we had the snowstorm of 2021, yeah? And so in our labs, we actually had a warming center for our students because they were out of heat, and the water pipes had burst all over. And I'm from Nebraska, so I'm used to the cold, so it's no big deal for me, right? And I get a meme sent to me via email that says, imagine moving away from Nebraska to get away from Nebraska, and it follows you to Texas. So anyway, and then just this last spring here, we had early summer, I guess, we had a water main breakdown there, and we were out of water for about 5 or 6 days. Again, I'm kind of outdoorsy, so I was just in the backyard, just rinsing off, no big deal for me, you know, it's just me and my dog, but we had to stop because we didn't have any water in our facilities, and so again, we had to transition to those online kind of things, and think about how you guys took those in stride, okay? All right, I know that that's challenging stuff to have happen, but it's going to serve you well when you get out in the clinic, okay? And so think about all the work and effort that you guys have put forth and how much stronger you are now versus that first year when you guys walked in, okay? All right, this class in particular is very cohesive. They've been kind to each other. They've been supportive of each other. They've helped each other through good times, bad times, struggles, and challenges, okay? They've celebrated their engagements and marriages, and then, of course, mourn losses and other things, too, throughout this course. And also, they've been supportive of each other just with the graduate program in general, which is very challenging, okay? We all come into this program at different stages of life and at different experiences, and I think it's really good that you guys get to meet each other and interact with each other and understand each other a little bit. This will serve you well as you go out into the clinic, too, okay? It also changes you. You're never going to watch somebody walk in the mall with a cane again without looking to see, is that the right height? Okay, is that a hip or a knee? I don't know. Let's look and see. Okay, you know, it's never going to happen again. And you're never going to feel the same about action movies. Somebody gets shot in the shoulder, and you're like, that for sure took their brachial plexus or some of their arteries and veins. So it ruins action movies, and wall walking and wall watching is different, okay, altogether, okay? So you guys have shared experiences there, and it's really changed you guys. But you guys have studied the body. You guys have studied physiology, pathophysiology, and neurology, and things in depth, and how we treat and manage and help our patients with these difficulties that they have when in a clinic. This portion of it, this white coat is significant, and it signifies that you guys are going through another transition. You guys are becoming clinicians and practitioners, okay? We're going to put this white coat on you. You guys have been students for these last 2 years, and you've learned a lot. And just as what was said before, this next portion of it, this next 10 months, you will learn more from your patients than you will from anything else that we can teach you, okay? You're going to be guided along by your clinical instructors. But you may not also realize this, but you've already learned more from your first patient, okay? Your first patient was when you walked into anatomy and you had a body that somebody had donated for you guys to learn more from than you could possibly ever learn anywhere else. So you guys treated that with professionalism, respect, care, and dignity. So I'd expect no more from you guys in the clinic, okay? All right? I don't want to, I'm going to get, well, I'm very proud of you guys, okay? You guys are much stronger and more capable than you know. And just realize what you've accomplished over the last 2 years and know that this next year will be even more formative for you guys as you're out in the clinic, okay? So let's finish with a joke, okay? Since I tend to put memes on the end of my lectures. And so do you know what I love or I would love? I would love to get paid to sleep. Some people would say that would be my dream job.
All right. Well, they saved the best for last, that's for sure. I'm Bethany Allen, and I am going to present to you guys the Odessa class. Assisting Dr. Timbinsel, we have Dr. Deborah Edwards, who's the original dean of the Odessa campus. So the first one up is Alondra Castellanos. Elizabeth Condor. Alyssa Flores. Marilyn James. Garrett Lawyer. Robert Main. Leo Mendoza. Madeline Mistich. Andrew Morales. Shivani Patel. Holly Rates. Cassie Sapien. Kristen Schaefer. And Bailey Wallace. Congratulations, everyone.
Dr. Allen, I thank you for the introduction, the kind introduction you gave me. She said that they saved the best for last. But as I look at the program, we've got the order of ceremony here. The students planning this, they only gave me 1 minute for closing remarks. It's almost like you guys don't know me at all. They also said that we're supposed to start closing remarks at 12:27, and it is 11:55. So I've got a little bit of time. Excited about that. Guys, one more time, class of 2023, round of applause. Class of 2023, you guys owe a round of applause to some people sitting behind you as well. We have some littles in the room who have been showering us with a little bit of noise, which we don't mind at all. Because you know what? Many of you guys in this audience have heard these students the very same way, right? And not just when they were babies, but also when they were going through physical therapy school. And they call you up, and they're crying. Guys, we talk about blood, sweat, and tears. There's blood, sweat, and tears in a program like the Doctor of Physical Therapy program here at Texas Tech. There's hard work, there's effort, okay? And you guys should be proud of what you've accomplished, but you're not done yet, okay? You've heard me say this, and I'll repeat it again for the family in the room. When you think about contact hours in physical therapy school, okay? Face-to-face, one-on-one, or not one-on-one, but at least in class and those kind of things, when you think about the number of contact hours, there's more contact hours in the clinical experience portion than there are in the didactic classroom portion. Even though you spent 2 years in the classroom, you have 36 weeks of 8 to 5, 40-hour-a-week clinical experience, okay? There's a lot left to learn. There's a lot to uncover, things that you had buried under other things, right? Things that you've got to dust off, that you have to remember. You're not going to remember it all, okay? And your patients will help bring up to a point what you didn't remember and what you need to go back and review, okay? Beyond PT school, you've got 32 weeks in front of you of clinical experience left, and then you're going to graduate. You got something else hanging out there in front of you, right? We're not going to talk about that today because I don't want to put a downer on the mood. But you guys have a licensure exam, and then you're going to have a career in front of you, okay? That first year to 2 years of practice is a learning experience all by itself because you're going to have hundreds and thousands of repetitions of various patients coming in to see you. And you're going to learn more from those guys than you probably did in that 32 weeks of final clinical experiences. You're going to learn from your peers that you're out there with, your mentors in the clinic. Find a place where you can settle in that has good mentorship if you can, because that's going to be invaluable to you as you move into the early portion of your career. Seems to be a popular thing to say 3 points to remember and close out. So I've got my 3 points written right here, okay? First one is own it. Own it. Okay, you guys are in a spot now where you're going out and you're going to apply your education. You have to go out and own who you are as first a student physical therapist in the clinic working under a clinical instructor, but then as you get into your career, own it for who you are as a physical therapist. Okay? There's something called Imposter Syndrome. We talked about it before, right? How many of you guys feel a little bit of an imposter syndrome sometimes? All of us do, because you wonder, do I really know what I'm doing? It took me a year or two of practice after my graduation before I really owned it. But you guys have to start that a little bit sooner. You've got to get out there and you need to get comfortable in your setting. You need to get your foundation sunk in as far as the setting that you're in and working with your clinical instructor. But then as you get in there and you're in that week 3, week 4, week 5, you got to start owning it. What would you do if your clinical instructor wasn't right there, bouncing ideas off of you or letting you bounce ideas off of them? Could you come up with what's next? Could you come up with that next intervention? Could you do that assessment? And guys, really, you can. You have the background in the clinic, or you have the classroom background, and you're going to supplement that with the clinical background. You're going to be able to make those decisions. You're going to be able to do that. Grow in your confidence as a clinician, but stay humble too. Dr. Gilbert would echo that, and he will echo that in grad seminar week before you graduate. Okay? Stay humble. Realize your education and realize all of physical therapy is 2 questions, right? What's wrong with them? How do we fix it? It's that simple, guys. You didn't have to go through 2 years of education to figure that out. It's that simple. What's wrong with them and how do you fix it? Now we had to teach you what was wrong, and then we had to teach you how to fix it. But when you get confused on that really complicated patient, what's wrong with them and how do I fix it? Okay? Justify your ideas. If you have an idea on what to do for a patient, on how to fix something, ask yourself 2 questions. Do I have a justification for it? Is it safe, or can I make it safe? If the answer to those 2 questions is yes, you're probably okay with trying it out. It may not be the world's best PT intervention ever, but you're never going to have the world's best PT intervention ever. Okay? That's okay. It needs to be safe and effective. So own who you are as a student physical therapist going out in the clinic. Stay humble, but have some confidence in the background that you've been given. And start seeing yourself more and more as you go through your clinicals as an autonomous practitioner, because that's what you're moving toward. So own it. The next thing is live it, okay? Live it. Figure out what fits you in this profession. And it is a career. As Dr. Kern said, it's not just a job, it's a career. But we all know that we have different priorities in life, okay? Some of you, it's faith. Some of you, it's family. Some of you, it's your career. And those different priorities, you have to figure out how to make those all mix together because you're in a career. And you have a profession that needs you, and you have patients that need you. And so make it fit within those priorities in your life. If family is your priority, and it should be for all of us, that's great. Make your career fit within that successfully, okay? Don't put your family behind your career, because we need those guys. We need your family. But make it fit, okay? When you're treating your patients, leave your baggage at the door, because life happens. I had a great CI when I was a young PT, just finishing my PT education, and she was going through some of the hardest stuff, and I never even knew it until after I graduated and actually started working with her and became a coworker. I never knew it because she left her baggage at the door because she was there for her patients. Her patients were not there for her. Okay? You guys are in a service profession. Leave your baggage at the door. Check your stuff. Go treat your patients. They deserve your attention, and they deserve to be a priority while you're there in the clinic. Treat all your patients with respect. Doesn't matter if they look different than you, if they believe different than you, if they act different than you. You're called to care. You're called to be above that. You're called to treat your patients with respect, and the respect that all of us deserve, okay? Bring your patients into a partnership with you. Live out your code of ethics, live out your ethos, and bring your patients into partnership with you and treat them. Live your life as a PT. And finally, grow it, okay? From this point on, you're still going through your school, but you're about to get out and do some things full-time in the clinic that you haven't done before. And then later on, you're going to graduate and then begin your career in earnest. You've got to grow it. Don't sit still, because if you sit still and just do the same thing over and over and over and over again, you're going to stagnate. And stagnation will lead to poor satisfaction in your career, and your patients may still be getting better, but they're not getting your best. Okay? So grow who you are. Don't stagnate. Do strive for excellence, and do strive for honor, because that's what we're called to do. Strive for honor evermore, right? That's the motto of Texas Tech System, and that's what we ask you guys to do. Strive for honor in your career as you get out into the clinic. So that's all I have to say. One more time, class of 2023, we're proud of you guys. Remember that you still have the support of your family that's sitting behind you. You still have the support of your professors that are sitting up here on stage. You're not on an island out by yourself in the clinical experience world, okay? If you have questions, get in touch with us. If you have concerns, get in touch with Dr. Miller as soon as possible, okay? Very good. Thank you all for coming today. This concludes our ceremony. We're going to ask the students to stay up front here because there's going to be a class picture up here on stage. Thank you all, and we're dismissed.